All right, I'm really happy to be part of this Manage Endo presentations that Quendo has organized. So my name's Natalie Moore. I'm an osteopath in Brisbane, and I'm also an integrative breathing therapist. So a little bit about me. As an osteopath, I have a specific interest in sleep and women's health. I have a master's degree in dysfunctional breathing. I've been working a lot with people in the osteopathic guided frenectomy. And I'm also founder of my business, More Pathways, which will have integrative learning, online learning, and also a clinic where we focus on sleep and women's health. So my top tips and strategies for today, I'm going to take you through a few breathing a few breathing practices that we can do. And I think with people with endo, we learn a lot about different breathing techniques because we learn that breathing is really important for pain relief and for diaphragm function. But what we don't actually learn is how to fix our breathing if our breathing is dysfunctional. So we're going to go through a few strategies. I'm going to teach you the importance and the wisdom behind exhale breath holding. We'll go into some humming and alternate nostril breathing, and I'll teach you a little technique that you can use anytime, which is a nose opening smile. So when we're talking about breathing and what functional breathing should look like, our breathing shouldn't just be diaphragm breathing, it shouldn't just be into the belly, but rather our breathing should encompass the whole body, and it should change and it should adapt to what we're doing. It should be appropriate to what we're doing, and it should respond to what's happening within our life, and it should support what we're doing. So by that, I mean, if we're running up the stairs, should be very different breathing to when we're laying down in bed sleeping. So what happens when these breathing or the functional breathing isn't quite working very well? Well, it starts to have an effect on all these things within our body. And this is why it's so important when we're working with endometriosis as well. So we learn a lot about why the diaphragm is really important, and you might have been taught how to diaphragm breathe to relax your pelvic floor and to improve the pain and your pelvic pain that is seen with endometriosis. But it's also really important for our sleep. It's important for our pain control. Research suggests that breathing exercises can help reduce pain. But our sleep is really important as well, because research has also found that a substantial amount of people with endometriosis also suffer poor sleep quality, and breathing is where we can start to improve that as well. Breathing is really important for emotional regulation, maintenance of pH, which sort of lends into inflammatory pathways. It's really important for fluid circulation and the dynamics of fluid throughout the body. This is really important for lymphatic and congestion in the pelvis. And it also helps our spine and our pelvic stability, as well as that the gut health as well, that we continually hear so much about within endometriosis management. Deep breathing, we have found, increases the volume of cerebral spinal fluid, and this causes nice oscillations of the cerebral spinal fluid within the brain and the ventricles. This is also really important for sleep health, for inflammatory pathways regulation, and for pain as well. So when we're talking about breathing, we hear a lot about the pelvic breathing, diaphragm breathing, but really breathing starts right up at the nose. The nose is thought to have over 30 functions, but the most basic functions is to really warm and moisten the air we breathe and provide that first line immune defense as well. The nose is the beginning of the respiratory system. So that's why when we start doing breathing practices, we really should start right at the beginning. It also improves when we really learn how to breathe mindfully through our nose. It improves our diaphragm function through patterning pathways, which improves our postural mechanics as well. By breathing mindfully and slowly through the nose, we start to breathe smaller amounts of air as well, and we start to regulate our carbon dioxide and our oxygen within our body. The nose also sends signals to our brain, and that informs our brain about the pattern and tempo of our breathing, which in turn sends information to other systems, such as the heart and the nervous system, which is really important for nervous system regulation, sleep, inflammatory pathways, these things that I keep going on about. And that's why we kind of call the nose the honer of sleep. So sleep is essential for brain and body emotional regulation. It physically recovers and repairs. It supports brain changes and development. So especially if you are doing a practice, it's really important that you sleep well after your practices, because that's when the brain's really going to integrate those practices. It helps us integrate negative experiences. So if you're a person with chronic pelvic pain and you're doing a lot of therapy, it's through sleep that's really going to start to integrate everything, all those practices, everything you learn, but also integrate those negative experiences you're having as well. Sleep affects the pain and inflammation. It improves our memory, cognition, and decision making. So it's a biological function essential for life, and it's the ultimate salve for many chronic and inflammatory ailments and flare-ups as well. So I don't know if you're a person that, if you're having a major flare-up, if you get a good night's sleep, you'll often feel better in the morning. But what's happening if we're not getting that sleep? So here is where we start to utilize and improve the function of those structures that are going to help you get better sleep, help you get better connection to your diaphragm so that you can do your diaphragm and all the exercises that you've been told. I really love exhale breath holds. There's a reason for that, and mainly because it helps us unblock the nose. It helps increase carbon dioxide within our body. Carbon dioxide is really important because it's a molecule that's going to carry oxygen into your tissues. It helps stimulate the vagus nerve. It enhances our lung function. It improves our breathing control and our pattern of breathing. And it's a tip that can help manage your anxiety and your sleep disorders. So let's go through what an exhale breath hold might look like, because there's a few different ways that we can do this. We can use it as a bit of a rescue breath when you're feeling that you need to take a moment to regulate, that you feel like your breathing's getting a little bit quick and a little bit high. And it just goes gently and softly like this. It's a gentle breath in. So we're not going to be doing a big, we're going to do a nice, gentle, easy breath in, always through the nose. Easy breath out and hold. Whilst you're holding your breath, your tongue is going to be pressed to the roof of your palate, and you're going to be mindful about the sensations in your body. And this can be a reset for your breathing. Another way that we can use exhale breath holds is to unblock the nose. So if you're really struggling with breathing because you're so congested, maybe you're sick, maybe you have sinusitis, maybe you have allergies, this is the way to unblock your nose. So we're going to do an easy breath in, easy breath out. We're going to hold our nose, and then we're going to tip our head backwards and forwards. Hold your breath for as long as you possibly can. And when you're finally ready to take a deep breath in, you're going to breathe in through your nose with your tongue pressed against your palate. Now, if it doesn't unblock immediately, you're going to do that 2 or 3 or 4 times. The moment that you really feel like you're definitely not going to get any air in, that's the moment that your airway is going to open, I promise you. So the trick to this is start to get a little bit more comfortable with that panicky feeling of not getting enough air in. That's just a buildup of carbon dioxide, and your body desperately wants to get all this oxygen in, but it's okay. We're here to open our nose. And the more we work with this exhale breath hold, the more we build up the gas that's in our nose. That helps dilate the nose. It helps fight off fungal infections, viral infections, and this is how we're going to boost our immunity and our first line immune defense, which is our nose. So have a little practice with those. They're really nice. The next technique we're going to go through is humming. And we're going to use humming and alternate nostril breathing at the same time. So humming trains the muscles. It improves vagal tone, which I've heard, I think you've probably heard a lot about the vagus nerve. It increases mechanical oscillations. So that's just within and around the sinuses, especially if you're getting congested. It raises that nitric oxide, which we were talking about, helps anti-inflammatory and dilate the nose, reduces congestion. It improves the nose to brain connection. It reduces nasal hypersensitivity. So if you're a person that's hypersensitive to smells, allergens, it improves airway muscle tone. And most importantly, for you guys with endo, it improves the nose to diaphragm connection. And we can use any sort of humming that you'd like. The way that we're going to, then the reason why we're going to use alternate nostril breathing is that we're going to use the alternating flow of breath between the left and right nostrils. So that is believed to harmonize the two brain hemispheres, and this helps to focus and foster mental clarity. And this practice has been associated with stress reduction, promoting a calming effect on the nervous system, and encouraging relaxation. It enhances respiratory primary function, and it facilitates a deep rhythmic breathing that can benefit respiratory conditions as well. So let's go through them now. There's a few different ways we can do it. So we can use our thumb and we can block one nostril. And we're always going to start with the left nostril. That's because the left nostril is associated with the parasympathetic nervous system, so the calming part of our body. And we're going to slowly breathe in. And as we breathe out, we're going to hum. Breathe in. Block your left nostril, open your right. Breathe in. Block your right, open your left. And you can go on like that. Another way that we can do it, if you're a person that has, and you might have heard, I was a little bit more blocked on this right side. So I can use humming to unblock that nostril as well. And we can do that by pressing our nostril up, and that just helps that mechanical oscillation. So enjoy the alternate nostril breathing with the humming. It's actually really calming. And once you try it, I think you'll find that it's really quite lovely. All right. So another technique that we can use, and you can use this anytime that you're doing a breathing practice, is the nose opening smile. This is to help train the posture and the tongue position. It encourages you to connect with the sensations of breathing. It's the way that we do it is that we savor and imagine and enjoy the feelings that are coming into our body. And we inhale. As we inhale, we smile and relax. And we use the muscles in the face to help open the nose. And then we follow that breathing down into our body. When we start to do this and we start to breathe slower and start to reduce that air that we're breathing in a mindful and relaxed and joyful way, we start to rise our tolerance to carbon dioxide, which is going to help bring oxygen into our muscles. It's going to help with anti-inflammatory pathways. It's going to start to establish a slower breathing rate, which is going to take that load off your diaphragm and start to relax through the pelvic floor. And this has positive effects on the autonomic nervous system. The other thing that we can use during the nose opening smile is the sensory function of smell. And this is where we can use imagination, or we can use smell as well, because through really complex nervous system, the nose relays really important information from our environment to the brain. And it has connections through the limbic system, which is important for emotional regulation. And this in turn sends signals to our nervous system. So by using the sense of smell, we can start to improve our emotional state as well. So you can do this with a some oils, some essential oils. You can do it with paying particular attention to maybe the tea you're drinking or some flowers, or you can use your imagination. Research has shown that the more imagination we use in our practices, the stronger these pathways are going to happen in our brain, which are going to change it on a neuroplastic level. So the way that we use the nose opening smile is just how this woman is doing it on the screen here. She's doing it perfectly. So we're going to upturn the corners of our lips, feel really light in the middle of our forehead. And as we breathe in, we're going to imagine our face widening. Savor that breath coming in through the nose. And as you're breathing in, just follow where that breath naturally wants to go into the body. And just be curious about that. We're not going to try and judge it. We're not going to try and say, oh, it should be going down into my belly. I should be belly breathing. We're not going to do any of that. You're just going to smile and savor that sensation of air coming in through your nose. Now, our mindset is really important in all of these breathing practices. So we're going to approach our breathing practices and a sequence of breathing through noticing the natural changes rather than forcing it. We're going to feel and sense rather than doing. And we're going to create an internal state of engagement and curiosity and relaxation. And here's what a practice might look like to you. So we know by doing at least a 15 to 20 minute of practice a day, at the same time each day, using that mindset, we can start to change things on a brain level. And we can do these in different blocks as well. So a 15-minute practice might look like something on the screen. We might start with a short breath hold, and then we might hum for 3 minutes, and then a breath hold. And then we might want to do alternate nostril breathing. A breath hold, humming again, and maybe this time we're humming with the alternate nostril breathing. And then the NOS on your screen means nose opening smile. And we're going to follow and savor those sensations down into our body. And we're not going to try and breathe big, remember. We're just going to try and breathe low and slowly. Then we might do another alternate nostril. We might finish or even start our practice with the nose clearing breath hold, especially if you are congested and you still want to do your breathing practice. And then I like to say that we sit after the full 15 to 20 minute practice, and we notice and take note of what's happening within our body. We don't have to judge it. It doesn't have to have good or bad attached to it. We're just going to notice. And then take a moment to write down how you're feeling. So remember, this is major. It doesn't really matter what techniques you're doing with breathing. You're going to notice the changes rather than forcing them. So you're not going to try and do big belly breathing. You're not going to try to make your diaphragm go whatever shape you think it should go. You're just going to notice what your natural breath wants to do when you're using those techniques, like the nose opening smile, for instance. You're going to really feel and sense rather than trying to do again, and just become very curious about your body and about the state of what's happening within your breath as well. So that's just a few little tips. I go into much more detail in other courses and programs that I have, especially if you're a person that is struggling with nasal breathing, if you're a person that is breathing through their mouth predominantly. If you find that breathing is a little bit difficult for you, especially if you're being told to do breathing practice to help with your pelvic pain or your back pain or your gut or anything like that, if you're struggling with sleep, then perhaps there might be a program that could help you out. All these tips would be a really great place to start. And you can find me at morepathways.com.au. Thank you so much.